Welcome to LGBT Senior Housing and Care. LGBT Senior Housing and Care provides training and technical assistance to implement affirming and welcoming practices, protocols, and programs to serve LGBTQ older adults. This LGBTQ sensitivity and competency training is applicable for older adult communities, senior service agencies, senior care providers, long-term care and rehabilitation, business, and educational settings. This video is an introduction to the need for LGBTQ cultural sensitivity training in older adult services and not a substitute for an affirming and welcoming training program. Why is LGBTQ cultural and sensitivity training in older adult care needed now? 4.5% of older Americans identify as lesbian, gay, bisexual, or transgender, 2.4 million of whom are 65 and older. Within 10 years, that number is expected to rise by 50%. And millions more family members, friends, and healthcare decision makers are LGBTQ and their allies. There is a growing need for LGBTQ trained providers in housing, long-term care, home care, and other adult services. It is projected that up to 300,000 LGBTQ seniors will be living in long-term care facilities by 2030. The United States federal anti-discrimination policy makes it unlawful for any healthcare provider that receives funding from the federal government to refuse to treat an individual or to otherwise discriminate against an individual based on race, color, national origin, sex, age, or disability. Sexual orientation and identification are not yet considered definitions of the term sex in the regulation. Currently, 21 states have some form of LGBTQ anti-discrimination legislation prohibiting discrimination on the basis of sexual orientation and gender identity in the areas of employment and housing. 2 states, Massachusetts and California, have passed LGBTQ+ older adult anti-discrimination and rights legislation. In New Jersey, legislation has been introduced to establish anti-discrimination training and inclusive service requirements for LGBTQ+ persons in long-term care communities. Senate Bill 2545 will apply to the 365 nursing homes and continuing care communities in New Jersey and will influence policy at hundreds more assisted and independent living communities. LGBTQ older adults are less likely to have close family to rely on as they age, less financially secure, more likely to face discrimination in housing, and face an array of unique barriers and inequalities that stand in the way of a healthy and rewarding later life. LGBTQ older adults experience all of the traditional challenges inherent with aging, including loss, isolation, physical and emotional health issues, memory loss, and fear that transcends all socioeconomic, racial, and cultural boundaries. Many LGBTQ older adults fear discrimination when moving to a long-term care setting. They believe that they will not have equal access to social and health services, and that they will have to hide their sexual orientation and go back into the closet when entering long-term care. A 2011 national study of 2,560 LGBTQ seniors aged 50 and older found greater rates of disability, depression, and loneliness, an increased likeliness to smoke and binge drink, increased health barriers due to isolation, lack of LGBTQ health providers, and culturally competent service providers. There is a lack of LGBTQ-trained physical and mental health care providers to serve the community. Physical and mental health disparities for LGBTQ older adults are found across the community. Gay men are more likely to experience heart disease and stroke, and have an increased risk for cancer, STIs, HIV and AIDS, and hepatitis B and C. Lesbians have an increased risk for breast cancer, obesity, and heart disease. Transgender persons have an increased risk for physical assault and abuse and risks associated with hormone replacement and gender transition procedures. Higher rates of depression, anxiety, and post-traumatic stress disorder, suicide ideation and attempts, smoking, drug, and alcohol use. LGBTQ older adults experience additional barriers to health care due to lack of access, transportation, and health insurance, bias and stigma in care, fear, poverty, homelessness, and a lack of culturally competent providers. Creating an affirming and welcoming environment through cultural and sensitivity competency includes both non-discrimination policies and implementation of protocols, policies, and programs that are inclusive of the LGBTQ older adult community. Everyone at every level of the organization should engage in LGBTQ older adult competency and sensitivity training. Cultural competency and sensitivity training in senior housing should also include board members, administration, and staff, community life directors, resident and family educators, vendors and contractors, union affiliates, family, allies, and the broader community. To be LGBTQ inclusive and affirming, facilities, communities, and agencies need to provide access to certified LGBTQ-trained physical and mental health providers across service and care departments. Many family members, staff, employees, and vendors identify as LGBTQ. Implementing LGBTQ welcoming and affirming policies, protocols, and practices in your community, agency, or organization will create an environment that is welcoming to all. LGBTQ training creates opportunities across the organization, enhances organizational focus on person-directed care and healthcare and services. Raising the competency bar for the LGBTQ community raises the competency bar for all. Providing services to an underserved market increases company market share. Follow the LGBT Senior Housing and Care Roadmap of assessment and planning, training and education, community life and communication strategies, strategic partnerships and advocacy, technical assistance and continuing education to achieve affirming and welcoming housing and care for everyone. While we experience these unprecedented times and barriers to sharing this work with staff and communities on site, our online and webinar training programs have been enhanced to enable effective LGBTQ+ older adult affirming and welcoming training to continue safely. In some cases, limited on-site training for small groups and on-site technical assistance may be arranged utilizing the safety protocols recommended by the CDC. A variety of webinars and online training programs are available on our website. Custom training programs can be created to service the unique needs of your organization, agency, company, or care setting. Continuing education credits may be available. Equity is a far more effective tool in achieving equal opportunity than equality. The route to achieving equity will not be accomplished through treating everyone equally. It will be achieved by treating everyone equitably or justly according to their circumstances. Race Matters Institute. Visit us at lgbtseniorhousingandcare.com to learn more about creating a welcoming and affirming culture in aging services for LGBTQ older adults. We look forward to guiding you on this transformative journey.